I'm talking, today's topic is about the ethics of palliative care, and my specific topic deals with legal issues. I'm specifically talking about the legal issues faced by nurses, experiencing compassion fatigue, nurse burnout, vicarious traumatization. These are all different words, but kind of meaning almost the same exact feeling or situation, where a nurse feels almost kind of just like the patient she's serving in palliative care, the physical fatigue, as well as the physiological changes. So finding himself or herself in a similar situation. And so there are subtle differences in all these terms, but it's kind of semantic differences. Basically, it just means that the nurse is pretty fatigued, and so the quality of care is definitely going to be diminishing as the nurse is kind of feeling pretty traumatized, suffering from trauma himself or herself. And so this can lead to medical errors, increase in mortality, patient mortality due to inadequate documentation, the charting errors, failures in communicating properly. And so there is a direct relationship between all of these errors and the burnout faced by nurses. So these kind of lapses and errors can lead to situations which could be adverse for the patient, and also lead to a high turnover rate where the nurse then either leaves the profession because he or she cannot withstand the pressures and doesn't like coming to work much anymore. And so these kind of legal situations can lead to cases of negligence and malpractice. Negligence and malpractice are kind of essentially the same. Negligence is not showing the level of care that you should have because of being careless, and malpractice is kind of negligence when a licensed professional has committed some kind of negligent error, such as a doctor or a nurse. And so that brings in legal aspects like lawsuits, etc., brought on by either the patient or the patient's family, because if such a situation leads to death or some kind of adverse situation, then of course they are going to seek some answers for it. Now, a lot of these ethical dilemmas that nurses face in palliative care is based on truth telling, and how much truth to tell the patients about their prediction of their survival, side effects of their pain medication, the changes that they're undergoing, the physiological changes, and why certain life-sustaining treatments such as antibiotics, other measures are being withdrawn. So that can lead to moral distress, and that moral distress is also when a nurse feels strongly that a certain level of care is being prevented from being given because the patient is palliative. And so those ethical dilemmas, and how should the nurse handle such a dilemma? It's one of the ways is to start palliative care early through focused interventions. And so that can minimize pain and suffering on the part of the patient, if those, instead of being given aggressive treatments in acute care, if they can be transferred to palliative, which wouldn't necessitate such kind of aggressive treatment. So if there's a standardized list of triggers for palliative care consultation, for example, which could be drawn up, which could then then that way a physician or a nurse can make an assessment about who should be in palliative care. Another way is to create these specialized palliative care teams and integrate them into ICUs. There are many specialized teams for different various kind of interventions. So a palliative care team would be one kind of intervention where they are trained for palliative care. And then both the patients, their families, and the staff can also be provided like a diary where they record their events, experiences, so that future things people can learn, or even the quality of care. The patient can make their own recommendations and choices. It gives them their autonomy, respect, and dignity about what type of care they are expecting and wanting, so as to increase the level of care and patient satisfaction, and also reduce that moral distress and compassion fatigue on the caregivers and the nurses. So in conclusion, palliative healthcare staff are faced with a lot of pressures, frustrations, and distress, which prevent them from fulfilling their duties. And one of the ways is that they're so invested in relieving the suffering of their patients that they forget about themselves and neglect to care for themselves. And again, in order to avoid unnecessary pain and suffering, instituting specialized palliative care units, initiating early palliative care through focused assessments are some ways that compassion fatigue, quality of care, and a lessening of errors and legal issues that can happen with a decreased level of care, as well as compassion fatigue, can be alleviated in palliative care. And that concludes my presentation.